And so what are the warning signs that you or somebody could have an eating disorder?
An eating disorder is, first of all, when food is used in a way where there's a significant weight gain, significant weight loss in a short amount of time, where food is used in a way that it interferes with one's life, either medically. I mean, anorexics have the highest death rate of men of any mental disorder.
Wow.
Yeah. So if food or the way you're using food interferes with your life, if you're making, even in the more subtle way, if you're making decisions around food in terms of your day-to-day activities and what you're going to eat and where you're going to go, and it starts to interfere with your life in any way, that's a warning sign. And also shame is a warning sign. So, I think food is great. I think people should be able to eat healthfully, but also enjoy food, blow out at times if they need to. But when shame becomes a part of the picture, an ongoing worry about what one's eating, that's when we start to see an eating disorder.
Yeah. No. And so
Yeah.
what's the difference between somebody who eats disorderly and then somebody who eats and has an eating disorder?
That's such a good question, and it's such a fine line.
Right.
Honestly, I think it's the amount of time someone's thinking about it,
Okay.
because uh, someone who, when I speak to people who are eating disordered, they literally will say if they did a pie chart of their life,
Right.
like 95% is thinking about food, calories, weight, what they're going to wear, how they're going to look. And the question, the question for me, I always wonder how you eat is like a reflection of how your relationships are.
Right.
And so if you've gotten lost to the way you're eating, I always wonder, have you lost yourself in relationships too? So
Right.
it's like food and weight are determining who you are. And maybe you get into a relationship, you want to be pleasing.
Mm-hmm.
It's that. So but the question for me is how much time you're thinking about it. And also obviously whether physiologically you're getting into trouble. Yeah.
And getting into trouble. Right.
Yeah.
Um, yeah. No. It's,
Well,
eating disorders and binge eating and, just cover the gamut. It's definitely something that I don't think, obviously you are one of the pioneers, but is researched enough just across the, gamut, because it is so prevalent. And I think a lot of people definitely hide it.
I think what's tricky about eating disorders is, anyone who starts with an eating disorder, who becomes eating disorder, anyone who becomes eating disorder starts with something benign. Like they're
Right.
just going to eat a little bit less, or they're just going to throw up this meal. It's not a big deal. There's no one who starts who thinks they're going to get into trouble. And the problem with anorexia is it can really be so value inducing. It can make someone feel so good when they lose a pound that suddenly that is what gives them value. Or with bulimia is really tricky because people can hide that for years. And it's such a slippery slope. Someone can start throwing up like once in a while over Thanksgiving, but it's so easy. The problem is it works. You can eat whatever you want and you can
Yeah.
get rid of it and it works. The problem is it then becomes like the solution, and then people are starting to think more about what they're going to eat, how they're going to get rid of it, than they're thinking about the person they're eating with at the dinner table.
Right.
And so when someone's trying to recover, they come to me because they're actually tortured. They're not tortured by their weight. They're not tortured by the food. They're tortured because they're thinking about it all the time. And part of what I'll say to them when they're at the dinner table is, first of all, are they being mindful about what they're eating? Are they even paying attention? We've all had those moments where we look down and it's like, oh my God, I just finished that. So how do you pay attention to who you are, how you're eating? But also I'll tell people, all right, look up. How are you feeling about the person across the table? What do you feel? Yeah.
In the news, there's a
Yeah.
lot of publicity revolving around younger kids having an eating disorder or are eating disorderly.
Yeah.
What do you account for the younger population?
Hmm,
Um,
that's such a good question. First of all, what's scary? When I went into the field years ago, there were residential programs for teenagers and young adults.
mhm.
About 10 years ago, treatment centers opened up for 8-year-olds, like 8 to 12-year-olds, and they're packed, they're filled. And I think it's a culture, first of all, the visual part of the culture that you're on social media and you have to show pictures of yourself. I mean, I grew up thinking I looked okay. Now that I'm on Zoom all the time, my image of myself has changed completely. And I don't know how kids deal with it. To have a picture of yourself up there all the time and then the likes. So
Yeah.
that's affecting kids. I think that the culture of striving and having to be the best, and there's a lot more pressure on kids to succeed. I mean, I'm a kid of the '60s, and
Mhm.
the idea was you graduate college and you travel around the world for a few years.
Right.
And now the idea is in third grade, kids are being asked, "What are you going to be when you grow up?" And they need to have an answer.
Yeah.
So there's a lot more pressure on kids. But I'm really, and we're in a culture that values thinness and values a very particular body.
Mhm.
And any kid who's young, 8, even 7, we have 5-year-olds who are on diets.
When someone is going to consult a doctor for treatment, what questions should they ask the doctor? And then also, I guess more specifically, what different treatment options are there? I mean, the way you work obviously is very different from a treatment center or maybe another professional.
Right, right. You know, the first issue would be to find out whether someone's medically stable. So if someone's concerned, they should go
Mhm.
to a doctor, and please go to a doctor who knows about eating disorders, because I've had doctors who've dealt with anorexics who say, "You
Right.
look great, you look beautiful."
Of course.
So ideally, a physician who knows about eating disorders would be able to establish whether there's a certain weight that needs to be held. We want to have doctors who are sensitive to people in larger bodies. That does not necessarily mean that the first thing is that you lose weight.
Mhm.
um, I think that the question is how someone's using food. It's one thing if you're in a larger body and you're enjoying food and you're just going to a doctor for a checkup. It's another thing if you know that you're using food to sort of evaporate yourself, to sort of lose time, or just to deal with feelings, and that you don't feel good about the way you're eating. And so I would want a physician to at least know whether you're in a place that medical stability needs to be the first line of treatment.
Yeah.
If it does, or if treatment is needed, the next step would be to see a therapist, because you want to know the psychological reasons why someone's doing this. But there's so many kind of therapists. There may be therapists that would work just on the behavior. There may be therapists who wouldn't work on the behavior. I feel strongly, being a psychoanalyst, that you still have to work directly on changing the behavior. Um, Boy, it's a big question in terms of what to do, because I think what you want to do is to make sure that you're medically stable, to make sure that the physiological parts of eating are being attended to make sure that you're understanding why you're going to food or restriction in the way you are. And what I would be wanting to do is are you paying attention to to eating in a way that you feels nourishing, fun, and healthful?
Mhm.
Are you paying attention to what your inner life is? If you weren't thinking about food at all, what would you be thinking about? And is that being paid attention to?
Mhm.
And in that regard, there would be different access to care if someone's in trouble. And by the way, if someone goes into therapy or sees a doctor and they start working on the eating disorder and there aren't any changes in really 2 to 3 weeks, I would be reassessing whether they need a higher level of care.
Right.
So if someone's coming in, they're throwing up every day, and 3 weeks later, they're still throwing up every
Yeah, that's
day.
a problem.
Yeah, exactly. And there's so much out there now. There can be an intensive day
Mhm.
treatment. There can be partial hospitalization, which might be just going for an evening
Mhm.
program. And then there's certainly residential programs throughout the country.
Yeah, absolutely. No, that makes sense. What would you tell someone, whether it's a friend, a significant other, a parent, who has a relationship, some capacity to someone who has an eating disorder?
Oh my God, that's such a good question. I'm the author of Surviving an Eating Disorder,
Right.
Strategies for Family and Friends. The fourth edition will be out in June. I've been writing it during COVID. Oh, there's so many things to say. First of all, if you think someone's in trouble, you have to say something. And you just say, and how do you say that in a way that's not hurtful, but just to say directly what you see, what you feel, and what changes you would like to make, and how you can help them. But I think the most important thing, and it's funny, you must encounter this when you're working with people who have differences that they're challenged by. As a parent, how do you see that the eating disorder or the difference is one part of the person, but not who they are? My best friend and partner in the book, Surviving, actually died of cancer when she was 40 years old. And yeah, and when it was a real traumatic situation, but when she was dying, she didn't think she was dying. She knew she was sick, but she said, when she had cancer and was diagnosed, she said, everybody treats me like I'm a cancer patient. She said, I have cancer, but there's 1,000 other things to me. And it's like, oh my God, she was right. Like we were just relating to the illness. And so one thing I would say to parents is look at where you've gotten locked in to seeing that person, the person you care about, as eating disordered. Who else are they? What are you missing? How has the relationship gotten stuck with a focus on trying to change them or help them? And if they weren't eating disordered, what else would you be feeling? What else would you be doing?
Right.
So, yeah.
Great advice.
I hope.
So fun. No, you're amazing. You give a
Oh,
lot of valuable information. And I think what's so cool about you. Anyways,
yeah,
you're a
thank you.
pioneer in what you do, and you give, you have amazing words of wisdom, and you're a great
Thanks.
therapist. And it should also be mentioned, aside from eating disorders, that you do also work with patients who have other regular common mental health problems.
Relationship issues, parent
Right,
issues,
exactly. So,
what we all have.
right.
Yeah.
So it's not, and obviously all of those, as we discussed, contribute.
Yeah, no,
But
thank you. And I love what I do. I think what
that's
I've always,
important.
yeah, what I've always tried to tell my kids is I just want you to do something that you love. You'll make
Right.
your way.